Hi, my name is Alli, and for my Capstone experience, I was looking at participation in adaptive sports to increase quality of life in individuals diagnosed with cerebral palsy. So, first, I completed a systematic review, and my research question is: in individuals of all ages diagnosed with cerebral palsy, does participation in adaptive sports increase overall quality of life? So, through my systematic review, I found that in individuals with cerebral palsy, participation in adaptive sports is recommended to improve quality of life. This is a weak recommendation based on low quality evidence. Therefore, participation should be encouraged, but data should be tracked in order to continually assess risk and benefits. So, my doctoral experience was actually through two facilities. One was through Leadership Education and Neurodevelopmental Disabilities, which is an interdisciplinary training program which offers clinical training, didactic coursework, and public health leadership projects. So, through the interdisciplinary developmental clinic, I was able to provide full occupational therapy assessment and recommendations as a part of an interdisciplinary and diagnostic team. And I was also able to do a leadership project through Moms to Be, which is a program offered for the first year of life, offered weekly to moms to provide them with education and resources to decrease infant mortality. And my leadership project aimed to provide these same moms with education and resources about development for their children ages 1 to 3 years old once they graduate from Moms to Be. My second site was Nationwide Children's Inpatient Rehabilitation, where I worked with many kids with conditions such as traumatic brain injury, spinal cord injury, stroke, neurological disorders, and orthopedic conditions. Here, I gained advanced clinical practice and assessment, treatment, and discharge planning for a full pediatric caseload. And I was also able to do a QI project that addressed home readiness for caregivers and training the caregivers when they're on the rehab unit in skills such as bathroom skills, dressing skills, mobility, and feeding to ensure safe discharge home for all of the kids. Lastly, my capstone project was through the Nice Hunger Center Transition Clinic, which is a diagnostic clinic for adolescents ages 14 to 22, primarily diagnosed with autism and intellectual disability. And many clients expressed interest in or could benefit from adaptive sports within this clinic, but there are no current resources available as the clinic currently stands. So, in order to implement adaptive sports into this clinic, I interviewed 5 stakeholders in order to better understand facilitators and barriers to implementation of adaptive sports at Nice Hunger Center. And through this, there are many themes, but overall, within the Nice Hunger Center, the clients only attend clinic twice over a 2 week span, and the clients don't have CP. There are no peers present during assessment, no resource guide outlining adaptive sports opportunities, and there's no follow up procedures. So, we deemed that it was appropriate to implement resources and education pertaining to adaptive sports into the clinic to facilitate a closer adherence to evidence based practice, as I found in my systematic review. So the implementation strategies, you can read them more closely there, but overall I created a resource guide outlining adaptive sports opportunities, provided staff education about adaptive sports, created flyers for clients to go home in their discharge summaries, and we're going to implement adding a question regarding adaptive sports into the already established 2 week and 6 week follow-up calls. So overall, Nice Hunger Center should encourage their clients to participate in adaptive sports utilizing the strategies provided, which will demonstrate closer adherence to evidence-based practice. And this will ultimately lead to increased quality of life for individuals participating in the adaptive sports. So now I'm going to answer a few questions. And the first one was what sports people were participating in my systematic review. And the sports included things such as bocce ball, horseback riding, soccer, swimming, and cycling. The next question is, how did I arrive at my PICO question? And I arrived at my PICO question, first of all, based on interest. I've always had a big interest in adaptive sports and how they can affect people's lives with disabilities. And then Nice Hunger Center identified a need for a client base that doesn't have many resources. And so it just was kind of the best of both worlds where I could kind of marry my interests as well as needs and create this project. And the last question is why I chose Nice Hunger Center. And the main reason is because this facility contacted me and they were really interested in gaining resources to provide information about adaptive sports to their clients. And they don't hire or have current staff members that are physical therapists or occupational therapists, and those are typically the people who know the most or have the most experience about adaptive sports. So it seemed like a great clinic to hone in my expertise and give them materials to better serve this client population. Thank you so much for listening.